Well, we are very excited to have such a distinguished keynote speaker for our program today. Our keynote is the principal advisor to the FDA Commissioner on Food Safety Policies, including implementation of the FDA Food and Safety Modernization Act and the new era of Smarter Food Safety Initiative. Mr. Yiannas comes to FDA from food safety leadership roles in both Walmart and the Walt Disney Company. He has long been recognized for elevating food safety standards based on risk and science. I am honored to introduce the FDA's Deputy Commissioner for Food Policy and Response, Mr. Frank Yiannas. Welcome.
Thank you, Tracinda. Sound check, can you hear me okay?
Yes, we can.
Perfect, perfect. Well, thank you, Tracinda, for that kind introduction. Thank you, Lori, for your opening comments. And Steve, I'll give you an amen as well. Very excited to be part of this session today, extremely excited, and was extremely motivated by the opening comments. Really excited about this. I'm grateful to have this time with you today, albeit brief, to talk about the importance of retail food safety, and in particular, retail food safety in an era of rapid change. If you can click once to get the next animation. I also want to thank not only all of the staff at FDA that's been so involved in pulling this off, but also the staff at AFTA for being a partner in this session. The turnout is impressive, and it just goes to show that you guys have done something correct. Now, let's go to the next slide. Before we get into the conversation about the future, which is something that I like talking about, I have to just pause and thank each and every one of you listening today for your role throughout the COVID-19 pandemic. We've all heard it stated, it's been a crisis of historic proportion. We all know that it's been probably the biggest test on the US food system in our careers, certainly over the past 100 years, and by and large, we've passed that test. We know the virus that causes COVID-19 is not transmitted by food. But I wanted to thank you for your heroic efforts. The men and women in food and ag, and certainly in retail as well, you've continued to show up each and every day to ensure that consumers and Americans across this land had access to safe, available food. So it's not only the hospital workers that are on the front lines, but in my view, you've been on the front lines. And I am just totally impressed and grateful for what you've done. You can go to the next slide. The pandemic has also illustrated the important role that retail plays. I have worked in retail for most of my career. The reality is the place where consumers get food today at the dawn of the 21st century, 2021, is at retail, whether it's a grocery store or food service or restaurant establishments. We're no longer hunter-gatherers. You know, over time, people started to domesticate plants and animals, and we had small villages and commerce in those villages. But if you fast forward to where we are today, retail is real critical. And I believe that retail really drives the food system. Now let's pause just with this idea that we have to look towards the future. Steve gave us a pretty good call to action because the world around us is changing. I think any of us who have been working in this profession for any period of time have to agree that never before have things been changing so much. We are living in an era of accelerated change. I've heard this quote recently, and I like to repeat it, which says, never before has the pace of change been this fast, and never will it be this slow again. Never will it be this slow again. It really is an accelerated pace of change that we're living in. And that is true for retail food and for the food system in general. We were thinking about this and talking about it at FDA before the pandemic, and the pandemic has strengthened our resolve on the need to further modernize how we approach the food system and how we approach food safety and advance public health. You can go to the next slide, please. Let me just illustrate some of the change that we're seeing. We know that before the pandemic, we were talking about the fact that it was projected that one out of every $5 spent on food would be spent on an online platform. We saw the tsunami of conversion to online shopping before food with traditional consumer goods, and we knew that conversion would happen with food. What we didn't know is that the rate of conversion would happen like a tsunami. And we saw, because of the pandemic, the call to action for people to shelter in place and stay at home, increasingly consumers getting on online platforms and ordering their food. And by the way, we saw demographics convert that we didn't think would convert. And we've blown these statistics out of the water because of the pandemic. I don't think this is a trend that's going to revert completely. I think these are new habits that are formed. And you might be asking yourself, well, Frank, what's the big deal? The idea that people are getting on digital platforms to order food. Why is that important to food safety? Well, I believe it's an indicator of the types of transformation and revolution it can have on food safety. And let me give you a couple of reasons why. If you can go to the next slide. In the 1980s, I would visit the grocery stores with my parents. You can click to the next slide, please. And what we would see is about 15,000 SKUs in the grocery stores that I visited growing up in New York and in Central Florida. You fast forward to the 2000s, we saw retail boxes getting a little bit bigger. We saw super centers, and we started seeing the number of food items that you could choose from increase, SKUs, stock keeping units, to about 50,000. And where do you think we're going? I think largely driven through this e-commerce world, omnichannel world, where you can go shop within a brick and mortar facility or get online and order. If you can click to the next animation, we're going to a world where there's an endless shelf, where consumers can get online and order anything that they want from anywhere in the world, almost in real time. That presents risk and challenges. It lacks convenience, obviously, to consumers, and that's a good thing, but it does present some challenges to food safety and public health professionals. You can go to the next slide, please. We also see how e-commerce is changing that never-ending last mile, and food is increasingly going from around the corner, which literally we would drive about a mile to the grocery store when I was growing up, to around the world. We have increasingly people getting online and going to their grocery stores to pick up the food that's delivered, and they put it in their trunk. Now you might think, that's not so different, Frank. Why is that important? Well, I've personally talked to a lot of consumers that tell me, I have a special dietary need, I have a food allergy. You know what? I don't feel comfortable getting online and placing my order because I can't pick up a product and read the ingredients. Sometimes retailers will make substitutions. And so how we're communicating with consumers is changing in this changing landscape. How about home delivery? Food's being delivered to people's front doors and being left there. Are they protected from being tamper resistant? How long do they stay at the front door? How about home shipping and meal kits? We've seen some reports, at least one study done from RICO, where they actually looked at temperature control of foods that were delivered, I guess, to one of their laboratories on campus, and over 50% of them were out of temperature. How about how they package them? Are they preventing cross-contamination? Are they providing instructions on how to prepare those foods safely? And how about the innovation that we're seeing in novel delivery, where humans may not be involved? Autonomous delivery to your front door, a burrito being delivered by drone. We're not talking about blue sky or the future. We're talking about things that are happening as we speak today. Next slide, please. And food service and restaurants are changing too. I use the term retail to define not only grocery stores, the types of stores that Steve was talking about, but food service and fine dining and institutional establishments as well. When you've gone to the restaurant lately, have you ever seen that there's not even a menu available and you have to scan to see what are the food products that you might order, or the menu items that you can select from? How about robotics and automation? We know that there's increasingly predicted that there's labor challenges in the US food system. Automation seen as a way out of this, but are we pausing to consider the food safety implications? I can remember earlier in my career, this pursuit of automation been going on for a while now. A restaurant at one of the Disney theme parks that sold a lot of pizzas. And rather than have people assemble the pizzas, they invested a pretty large figure on a machine called the Pizza-matic that automatically, based on the order that was placed, would assemble the pizza the right way, send it to an oven, and it would come out the other end through a conveyor. Now, there were food safety implications there. How long did food stay in the hopper? Could you clean the equipment properly? And so automation, while it'll provide for labor shortages, might present some new food safety risk. How about new foods and novel foods? We see restaurants getting creative not only in changing their menu offerings, but some restaurants wanting to produce foods in their facilities. I got an example of 3D printing, but there are others. We see vertical and indoor agriculture in some restaurants actually wanting to grow crops that they feed to their customers. How about changes in the way restaurants and food service establishments are designed? I think we're on the front end of a revolution in change with more and more pickup in delivery. And what does that mean to shrinking footprints, if you will, and the pressure that will place on people that are trying to design and minimize footprints, and for you plan reviewers out there, the challenges that might present in terms of safe preparation in a kitchen. And so we're living through a period of rapid change. You can go to the next slide, please. And so that's really the purpose of today's meeting. And Lori, I'm really grateful for the vision and the team at FDA and AFTA, really about moving forward in the future of retail food safety. And here's a basic idea, but I want each and every one of you to remember this as you deliberate during the next couple of days. What got us here to the year 2021, without question, is not going to be what gets us here to the year 2030. You heard that foodborne illness rates have not changed much decade after decade. The ADA compliance risk factors for retail establishments haven't changed much year after year. And the little icon on the bottom right is to suggest that if we're going to really bend this curve of foodborne illness, we have to do things differently. And so there's a call to action, a call to change. If you can go to the next slide, please. For us, it is about a new era of smarter food safety, which is completely aligned with your conversation here over the next few days. How do we use more modern approaches that are people-led, creativity, behavior change intended, continue to be FSMA-based, but increasingly technology-enabled? And so a new era of smarter food safety is meant to keep up with the changing world around us. You can go to the next slide, please. Now, what have we done as a retail food community? I've been part of this community for over 35 years. There are tools that we've used in our toolbox. Training, and I know now we have manager certification, and we're grateful for that. We've done inspections or audits. We're talking about more risk-based audits. And we've done a lot of testing, both at manufacturing and retail. Just think about this, despite the fact that we've trained, inspected, and tested millions of establishments, millions of foods, and millions of workers, food safety at retail remains a significant public health challenge. So the call to action is not only change, but to add new tools to your toolbox. If you can go to the next slide, please. Here's a quote that I love that hopefully will motivate you for the rest of the deliberations. And it's a quote from a behavioral psychologist, not a food safety professional or food scientist. If the only tool you have is a hammer, you tend to see every problem as a nail. And so I'm going to ask you to not think of only having the tool of inspection or training or testing in your toolbox, but pulling out another tool. You can go to the next slide, please. You know that the new era of smarter food safety has 4 core elements. They all involve retail, but 2 of them are really centrally focused on retail: the new business models and retail modernization and culture. And if you go to the next slide, what you'll see is some of the highlights from the different core elements. Next slide, please. We're going to take a fresh look at retail, as you've heard Steve and Lori mention. Some of the things that are planned, obviously, you've heard a little bit about the retail flexible funding model. You've heard from Lori and Steve how FDA has stepped up and put dollars behind our words, but clearly looking at full food code adoption, risk-based intervention strategies, and enhancing food safety management systems. But there's more. This is just a list. I've often stated that the FDA New Era of Smarter Food Safety Blueprint is not an action plan. There are things in there that we'd like to do, but there's a lot that remains to be thought of and initiated, and that's where we're asking you to help. You can go to the next slide, please. I hope by now all of you know that we're holding a virtual summit, e-commerce. It's scheduled literally for a little bit more than a month away. We hope that you all sign up. Next slide, please. And then you've also heard that we're very interested in behavior change, and that's where the term food safety culture comes in. These are some of the things we're doing at FDA, but there'll be more. let me begin with this idea. If you look at the pictures on the right-hand side of this slide, what do you see? Well, when I see the picture of PCA or peanut paste, if you think about that outbreak, when that outbreak happened, what did food safety professionals do? Shortly thereafter, they published reports about salmonella's ability to survive in low moisture foods. Well, in my view, this outbreak had more to do about an organization's culture than it did salmonella survival in low moisture food. Think about a brand that was repeatedly involved in outbreaks, repeatedly. In my view, that might have been a culture that was very focused on, saying that their foods were healthier and more local, but maybe not placing as much emphasis at that time. Now they certainly are on the importance of food safety. And then an ice cream manufacturer. This was an ice cream manufacturer that had been in business 108 years without ever having a single recall or a problem. You could see an establishment that never had a problem for 108 years, and the world around them is changing, and we got whole genome sequencing, and we can increasingly make the invisible visible. You can see where that culture might be a culture of complacency. And so I think culture is critical to advancing food safety. The fact that human behavior is central. In fact, I define food safety as food safety equals behavior, nothing more, nothing less. And so I think it's high time that we as a profession, both the public and private sector, start leaning in on these concepts of organizational culture and behavior change, combine it with our discipline of the food sciences, and collectively take a more behavior-based approach to advancing food safety. And so this is some of the things FDA will be doing. I want to close in the 3 or 4 minutes I have left, and then we're going to take some questions with the next slide, which is, I just wanted to give you some food for thought, the types of ideas and how we can think differently. And I'll go through this one real quickly, but I reached back into my toolbox, spending 35 years in retail food safety. And I thought, well, how did I advance retail food safety? And let me give you just a couple examples. On the bottom left, you see a raw chicken going to a cooked rotisserie chicken. Well, we coined something called a food safety task analysis. Just like in occupational safety and health, if people get repeatedly injured, you do a job safety hazard analysis to see what's the risk in that type of occupation or procedure. We did that for rotisserie chicken. And what we did is we took a 16-step rotisserie chicken preparation procedure and distilled it down to 6 steps, significantly eliminating risk. If you look to the right there, digital checks, 6,000 retail establishments across the US. They were inspected hundreds of times a month. Collectively, if you looked at local health departments doing inspections, I could have relied on the several hundred inspections that I got from retail establishments from local public health departments. But this organization hired a third party, and so literally had thousands of independent third-party audits done of those establishments. But the biggest thing that we did was we digitized all our internal food safety checks. And for those chickens, for example, I knew every time an oven of chicken was cooked because those temperatures were recorded, sent to home office in real time. N equals all. You can see what N equals all, and the temperature of all the rotisserie chickens, how that will outperform, a routine, infrequent inspection. If you look there, associates teaching associates. This is a principle of leveraging behavioral insights into how you do your work. You heard Steve talk about food safety culture sometimes starts from the bottom up. We know it starts from the top down, but the idea that when you do food safety training, leveraging a behavioral principle of likeness or homophily, that people will tend to listen and believe people that are like them. So if you have somebody that works in a role, having that person be a spokesperson. If you look at the top center, completion versus commitment. When people get trained, we always want them to sign a roster. So we have a record that have been trained, and if they don't comply with food safety behaviors, we can hold them accountable, write them up. Wrong reason. How about if you leverage a behavioral science principle of commitment that states, if somebody commits to something in writing, or better yet, verbally, their actions are more likely to follow through, well-founded in the behavioral science. So rather than have them just sign so you have a record of their training, make employees or associates commit to practicing what they've learned in the course. The last one I'll give you just because of time, bottom right, food safety by design. Wanting to reduce risk of listeriosis in delis. Now, clearly you're going to do a lot about temperature control, preventing cross-contamination, making sure that you clean and sanitize those slicers, including the equipment and floors and drains. But how about working with your suppliers to reformulate them? And that's what we did. Over 45 SKUs reformulated, so they all had a listeria inhibitor in them. So in the rare event listeria got into the product, it wouldn't amplify or grow more than one log in the shelf life of that product. These are the types of different ideas that I think we're going to need to advance retail food safety. You can go to the next slide, please. Hopefully that's some food for thought. Here's my call to action. Advancing retail food safety requires change. You've heard that loud and clear. You all have permission to question assumptions and old paradigms. We're asking you to do that. We have to add new tools to our toolbox. And I love this quote. It's not original by Yiannas, but I love it. A problem well defined is half solved. Spend some time defining what's the challenge, what's the problem statement that we're trying to fix. And really important in this era of change, don't let new business models outpace standards, controls, and preventions. Last slide, please. With that, I want to thank you for all that you're doing. I want to thank Lori for your leadership in your focus, being such a great retail champion. I've often closed my talks saying this. I believe it's truer today than ever before. There's a lot that the private sector should do to advance retail food safety. We should ask them to, we should hold them accountable, and they are. There's a lot the public sector can do to advance retail food safety, and you're going to spend 2 days talking about that, and we will, and we'll be successful. But what's clear to me now, having been on both sides of the fence, public and private, there's so much more we can do together. Thank you for what you're doing. Working together, we will advance retail food safety and bend the curve of foodborne illness so that consumers across this entire country can live better lives. Thank you very much.
Thank you so much, Frank. That was fantastic. We can take a few questions from the chat. If you'd like to put your questions in the Passable chat, we can go with those. We do have one, Frank, from Alan Tart, and he was asking that he's looking forward to the new Business Practices Summit that will be held next month to address the issues that you brought forward. Could we put in a plug for that for the webinar? I think we've got it in the chat there. Amy, I don't know if you could put that up as well.
Yeah, let's put the dates. Registration is open and we need as many people to sign up. It's going to be a 3-day event. I think about 2.5 days, but I encourage you. We're going to hear from consumer groups. We're going to hear from state and locals. We're going to hear from industry. We're going to get a good kind of hand on what's happening, what's the real practices that are happening, because as I state, what's happening on the ground is outpacing our ability to keep up with it. We're going to talk about what's the appropriate standard of care, and working together, we're going to make sure that these new business models and this ever-changing way of how consumers are getting food is as safe as it can be.
Thank you, Frank. There's been a lot written about FDA's work to enhance food traceability. How will this impact the retail food industry?
Yeah, well, I didn't talk a little bit about too much about food traceability today, but people know that it's a passion of mine. Let me just briefly state, if you were to ask me, what is the #1 thing that has advanced food safety into the 21st century? Frank Yiannas's answer is always, it used to be pulse field gel electrophoresis. Now it's whole genome sequencing. Our ability to detect, what used to be maybe sporadic illnesses, link them together and say, hey, there's some commonality. And when the epidemiologists start asking smart questions, we find out, they've all consumed a similar food or they've all been at the same place. Well, that's not enough, because what I've seen over the past decade on some outbreaks, and you can think of them, whether it's romaine or PCA, recalls coming in months afterwards because the peanut paste was in those products. We can find the needles in the haystack, the pathogens and the outbreaks, but we can't find the haystacks. What was the cause of those illnesses? So I believe creating better food traceability through tech-enabled technologies coupled with WGS is a game changer for food safety, because it creates a new level of transparency. I think it's going to affect retail, because I think it's going to provide retailers with a lot more information about where those foods are coming from. For folks on this call, public health professionals at the local, state, and tribal level, if you're asked for traceback records, that process is going to be different. It'll increasingly be electronic, and you'll be able to see almost in real time those food products coming back to source. I also think it's going to change the way we do tracebacks. We're starting to do some work where we receive traceback information digitally, as opposed to these invoices that we have to piece together because foods change ownership, and we know how hard and how long that takes. But when you capture traceability data digitally, you can have that enter into these analytical tools that can find associations faster and quicker, even assign confidence levels that you can't do when you draw a traceback diagram on paper. And so you'll see a different tech-enabled traceback methodology, I think, evolve here in the very near future, telling us where the contaminated foods came from. So it's not just for food producers, it will affect retailers and public health professionals at the local level. And it's really, really exciting.
Thank you, Frank. Another question, how can we better address cultural differences in food safety approach in light of our evolving workforce?
That's a great question. No, I think we have to be aware of culture at the 30,000 foot level. And we need to know that there's always subsets or microcultures within larger cultures. So we like to think, hey, there's a culture of food safety nationally. I think federal officials have an obligation to make sure that food safety is valued and appreciated at the national level. There are geographic differences, as you know, across the country. And then even within workforces, you can have a lot of different cultures and people from different backgrounds that speak different languages. I remember at one of my employers, Disney theme parks and resorts, on one of the cruise ships, we had over 38 nationalities represented. So you can imagine trying to teach food safety to people that speak 38 different languages as their native languages. I think you have to be aware of it. I think you have to appreciate and respect it. I used, for example, the principle of homophily or likeness. And so if you're teaching a certain demographic group, maybe be sensitive and cognitive that maybe somebody from their own culture might be a better spokesperson, might be able to convey the information better than others. I've been a big proponent for my entire career. I can remember many times over my career, I hear people say, hey, people are in this country, they should speak English, we should train them in English. I don't agree with that philosophy, and certainly not in the area of food safety. Food safety and safety is too important. Certainly people might grasp English and can say thank you or please, but when you're talking about critical concepts about cooking foods to certain temperatures and how to prevent cross-contamination, I want to make sure they understand it. And so I'm a big proponent of delivering food safety training and education in people's native languages and understanding cultural norms and what might resonate with them. So be aware of it and then work around it and take it into account. Don't be dismissive of it would be my suggestion.
Thank you, Frank. Can you talk a little bit more about the use of blockchain technology to ensure food trust?
Well, yeah, I'll speak real quickly on blockchain because I know a lot of people in the audience are saying, well, blockchain, is it a fad? We know it's associated with Bitcoin. It's not Bitcoin, it's the underlying technology. Pretty simply, this is it. We're pretty good at digitizing data, society at large. We've been digitizing data for decades now. But most of the data gets digitized in what is known as centralized databases. Somebody owns the database, it's controlled, you get permission to get in, and it's a centralized database. If you think about today's food system, I call it a decentralized and distributed food system. It's large. Nobody owns the food system, millions of farmers and growers all over the world, tens of thousands of food manufacturers. And trying to get all of them into a centralized database is never going to happen. Even when you're the world's largest company, you're going to have a hard time getting everybody into a single database. So blockchain technology defined is a distributed and decentralized digital ledger. It's not centralized, it's very decentralized. People can get into these digital networks and they can share information through a function called permissioning. Another unique feature of blockchain is once records are captured and different points in that system agree that record is right, you got to have a process of consensus. So no single person can easily falsify information because other people have to validate that. It's immutable. It's hard to change. You can't change it. But it's the decentralized nature of blockchain that I think make it of great interest to the food system because the food system is so large and decentralized. And that's why people often talk about trust because once a record gets in, it's immutable and you can't change it. So I think in time, we're going to see more and more solutions on distributed ledger technology, at least in the food system. It seems to be a good technology for food. I've often stated that you don't chase technology and say, I like this technology, let me see where it fits. You find what's the business problem or the public health problem, and then if the technology fits, you make it work. And so that's why I think if we really want to create a better system for tracking and tracing foods, or creating a more digital food system, that distributed networks might be more applicable than centralized digital databases. So that's the nutshell, but I encourage you to get out there. I've written some papers on it. I've given a lot of talks. There's a lot more to it, but I'm a big fan of distributed ledger technology, blockchain technology, and I think food safety professionals should pay attention to it. I believe that increasingly food safety professionals, unlike when I was growing up, have to be multidisciplinary, and it's not just good enough to master microbes. We got to know a lot more.
Mm-hmm. Thank you so much. Thank you so much for your leadership here at FDA. We have run out of time. I want everyone to know that the chat is being saved. It's all being recorded. It will be on Passable Chat so that you can review that at a later time. And also, this session is being recorded and you can view this for up to a year. I really want to thank you for being here. We're so grateful for your time today. This made this very special. Thank you so much.
My pleasure. Have a good meeting. Thanks everyone for what you're doing.
Thank you.